Have you ever wondered why some people discover serious diseases too late, even though they felt perfectly healthy? The truth is, many of the most dangerous health conditions don't cause obvious symptoms in their early stages. High blood pressure, diabetes, kidney disease, high cholesterol, and even certain cancers can develop silently for years before you notice anything is wrong. That's why regular medical testing becomes one of the most important investments you can make after the age of 50. Turning 50 doesn't mean your health will suddenly decline. In fact, many people remain active, energetic, and independent well into their later years. However, as we grow older, our risk of developing chronic diseases naturally increases. The good news is that many of these conditions can be detected early through simple medical tests, often before symptoms even appear. Early detection gives doctors more treatment options, helps prevent serious complications, and can significantly improve both quality of life and life expectancy. Unfortunately, many adults only visit a doctor when they begin feeling sick. By then, some diseases may already have caused damage to important organs, such as the heart, kidneys, brain, or eyes. Regular health screenings are different. They are designed to identify problems before they become emergencies. In today's video, we'll discuss 10 essential medical tests everyone over 50 should never skip. You'll learn why each test is important, what it checks for, how often it may be recommended, and how it can help protect your long-term health. Let's begin with one of the simplest but most important health checks. The first essential medical test is blood pressure measurement. High blood pressure, also called hypertension, is often known as the silent killer. Why? Because millions of people have high blood pressure without experiencing any warning signs. You may feel completely healthy, while increased pressure is slowly damaging your heart, blood vessels, kidneys, brain, and eyes. If high blood pressure remains untreated for years, it greatly increases the risk of heart attacks, strokes, kidney disease, heart failure, and vision problems. The only reliable way to know your blood pressure is by measuring it regularly. The test itself is quick, painless, and usually takes less than a minute. A healthcare professional places a blood pressure cuff around your upper arm, inflates it, and records 2 numbers. These numbers help determine whether your blood pressure is within a healthy range or if further evaluation is needed. If your readings remain consistently high, your healthcare provider may recommend lifestyle changes, home monitoring, additional testing, or medication depending on your individual situation. Simple lifestyle habits can also make a significant difference. Maintaining a healthy weight, reducing excess salt, staying physically active, managing stress, getting enough sleep, avoiding smoking, and limiting alcohol can all help support healthy blood pressure. Even if you feel perfectly fine, regular blood pressure checks after the age of 50 should never be skipped because early detection can prevent life-threatening complications. Now let's move on to another test that helps detect one of the fastest-growing health conditions around the world. The second essential medical test is blood sugar testing, including fasting blood sugar and HbA1c. Type 2 diabetes often develops gradually. In its early stages, many people experience few or no symptoms at all. Meanwhile, high blood sugar may quietly begin damaging the nerves, kidneys, eyes, heart, and blood vessels. A simple blood test can identify diabetes or even prediabetes before serious complications develop. Fasting blood sugar measures your blood glucose level after you have not eaten for several hours. The HbA1c test provides a different type of information. Instead of measuring blood sugar at one moment, it shows your average blood sugar level over the previous 2 to 3 months. Together, these tests give healthcare providers a much clearer picture of how your body is managing glucose. People with excess weight, high blood pressure, a family history of diabetes, or low physical activity may have an even greater risk of developing diabetes after age 50. Early diagnosis allows many people to control blood sugar successfully through healthy eating, regular exercise, weight management, medication when needed, and routine medical follow-up. Managing diabetes early can greatly reduce the risk of heart disease, kidney failure, nerve damage, and vision loss. Remember, diabetes doesn't always announce itself with obvious symptoms. Sometimes a simple blood test is the only way to discover a problem before permanent damage begins. Now let's continue with another important health test that reveals how well your heart and blood vessels are truly being protected. The third essential medical test is a lipid profile, also known as a cholesterol test. Many people think cholesterol is something they only need to worry about if they are overweight. In reality, even people who appear healthy can have unhealthy cholesterol levels. Cholesterol is a waxy substance that your body needs in small amounts. However, when certain types of cholesterol become too high, they can slowly build up inside your arteries. Over time, These fatty deposits narrow the blood vessels, making it harder for blood to reach the heart, brain, and other organs. This process, known as atherosclerosis, can develop silently for years without causing any noticeable symptoms. The first sign may unfortunately be a heart attack or a stroke. That's why a cholesterol test is so important after the age of 50. A lipid profile is a simple blood test that measures several important types of fats in your blood. It typically includes total cholesterol, LDL cholesterol, often called the bad cholesterol, HDL cholesterol, known as the good cholesterol, and triglycerides. LDL cholesterol can contribute to plaque buildup inside the arteries, while HDL cholesterol helps remove excess cholesterol from the bloodstream. Triglycerides are another type of fat that, when elevated, may increase the risk of heart disease. If your cholesterol levels are not within a healthy range, your healthcare provider may recommend lifestyle changes, medication, or both. Eating more vegetables, fruits, whole grains, beans, nuts, and healthy fats while reducing processed foods, fried foods, and excessive saturated fat can help improve cholesterol levels. Regular exercise, maintaining a healthy weight, avoiding smoking, and controlling blood sugar also play an important role in protecting your heart. Since high cholesterol usually has no symptoms, regular testing is one of the best ways to reduce your long-term risk of cardiovascular disease. Now let's move to another important blood test that provides valuable information about your overall health. The fourth essential medical test is a complete blood count, commonly known as a CBC. A complete blood count is one of the most commonly requested laboratory tests because it provides a broad overview of your general health. Although it involves only a small blood sample, it can reveal important information about several different systems in your body. A CBC measures red blood cells, white blood cells, hemoglobin, hematocrit, and platelets. Each of these plays an important role in keeping your body healthy. Red blood cells carry oxygen throughout the body. If they are too low, you may develop anemia, which can cause fatigue, weakness, dizziness, shortness of breath, or pale skin. White blood cells are an important part of your immune system. Abnormal white blood cell counts may suggest infections, inflammation, immune disorders, or in some cases, blood-related diseases that require further evaluation. Platelets help your blood clot properly. If platelet levels are too low or too high, the risk of bleeding or abnormal clotting may increase. A CBC may also help healthcare providers detect nutritional deficiencies, chronic illnesses, certain infections, and other medical conditions before symptoms become severe. Many people ignore ongoing tiredness because they assume it is simply part of getting older. However, persistent fatigue should never automatically be blamed on age. Sometimes a simple blood test can identify an underlying condition that is highly treatable. If your CBC results are abnormal, your healthcare provider may recommend additional testing to determine the exact cause. The purpose of this test is not just to diagnose illness, it also helps monitor your overall health over time and detect changes before they become more serious. Routine blood work, like a CBC, gives both you and your healthcare provider valuable information that supports better long-term health decisions. Now let's continue with another essential medical test that helps evaluate two organs your body cannot live without: your kidneys. The fifth essential medical test is a kidney function test. Your kidneys are two remarkable organs that work around the clock to keep your body healthy. Every day, they filter waste products from your blood, remove excess fluids, balance important minerals, help regulate blood pressure, and support the production of healthy red blood cells. As we get older, kidney function can gradually decline. Conditions such as diabetes, high blood pressure, heart disease, obesity, and certain medications can further increase the risk of kidney damage. One of the biggest challenges with kidney disease is that it often develops silently. In its early stages, most people experience no noticeable symptoms. By the time symptoms appear, significant kidney damage may have already occurred. That's why routine kidney function testing becomes increasingly important after the age of 50. A kidney function test usually includes blood tests that measure substances such as creatinine and calculate your estimated glomerular filtration rate, or eGFR. These values help healthcare providers understand how efficiently your kidneys are filtering your blood. A urine test may also be recommended to check for protein or other substances that could indicate early kidney damage. Early kidney disease can often be managed successfully when detected in time. Controlling blood pressure, managing diabetes, staying hydrated, maintaining a healthy weight, avoiding smoking, and following medical advice can help slow or even prevent further kidney damage. It is also important to use pain medications carefully. Some medications, especially when taken frequently without medical supervision, may affect kidney health over time. If kidney disease progresses without treatment, it can eventually lead to serious complications, including kidney failure, which may require dialysis or a kidney transplant. Protecting your kidneys starts with awareness, and regular testing is one of the simplest ways to identify problems before they become severe. Now let's move to another important organ that quietly performs hundreds of essential functions every single day. The sixth essential medical test is a liver function test. The liver is one of the hardest working organs in the human body. It helps digest food, processes nutrients, stores vitamins, removes toxins, produces important proteins, and plays a major role in regulating metabolism. Despite its incredible ability to repair itself, the liver can still be affected by conditions such as fatty liver disease, hepatitis, excessive alcohol consumption, obesity, diabetes, and certain medications. Like many other organs, liver disease often develops without obvious symptoms during its early stages. A person may feel completely healthy, while liver damage is slowly progressing. A liver function test is a group of blood tests that measure different enzymes and proteins produced by the liver. These results help healthcare providers determine whether the liver is functioning normally or if there are signs of inflammation or damage. If abnormalities are found, additional tests such as imaging scans or further blood work may be recommended. Some possible warning signs of liver problems include persistent fatigue, yellowing of the skin or eyes, dark-colored urine, swelling in the legs or abdomen, nausea, loss of appetite, or pain in the upper right side of the abdomen. However, many people with early liver disease have no symptoms at all. Fortunately, many liver conditions can be improved through healthy lifestyle choices. Maintaining a healthy weight, eating a balanced diet, exercising regularly, limiting alcohol consumption, avoiding smoking, and managing diabetes can all support better liver health. Regular liver testing is especially important for people with obesity, diabetes, high cholesterol, a history of hepatitis, or those taking long-term medications that may affect the liver. Remember, your liver performs hundreds of vital tasks every day without asking for attention. A simple blood test can help ensure it continues working properly for many years to come. Now let's continue with another important screening that becomes especially valuable after the age of 50 because it helps protect your mobility, independence, and quality of life. The seventh essential medical test is a bone density scan, also known as a DEXA scan. As we grow older, our bones naturally begin to lose strength. While this happens to both men and women, the risk is significantly higher in women after menopause because estrogen levels decrease, leading to faster bone loss. The problem is that osteoporosis often develops silently. You may feel perfectly healthy while your bones gradually become thinner and more fragile. Many people only discover they have osteoporosis after experiencing a fracture caused by a minor fall or even a simple movement that normally would not break a healthy bone. This is why a bone density scan becomes one of the most valuable screening tests after the age of 50, especially for women and for men who have additional risk factors. A DEXA scan is a quick, painless, and non-invasive imaging test. It measures the density and strength of your bones, usually in the hips and lower spine, helping healthcare providers estimate your risk of future fractures. The test itself usually takes only a few minutes and requires no injections or special recovery time. Certain factors increase the risk of osteoporosis. These include family history, low calcium intake, vitamin D deficiency, smoking, excessive alcohol use, lack of physical activity, long-term use of steroid medications, and certain medical conditions. If your bone density is lower than expected, your healthcare provider may recommend lifestyle changes, calcium and vitamin D supplementation when appropriate, weight-bearing exercises, or medications to help strengthen your bones. Simple activities such as walking, climbing stairs, resistance training, and balance exercises can also help reduce the risk of falls and fractures. Strong bones are essential for maintaining independence, mobility, and confidence as you age. Detecting bone loss early allows you to take action before a serious fracture changes your quality of life. Now let's move on to another test that protects one of your most valuable senses, your vision. The eighth essential medical test is a comprehensive eye examination. Many eye diseases become more common after the age of 50. Conditions such as cataracts, glaucoma, age-related macular degeneration, and diabetic eye disease can gradually affect vision, often without noticeable symptoms in their early stages. A comprehensive eye examination is much more than checking whether you need new glasses. It allows an eye care professional to evaluate the overall health of your eyes and detect diseases before permanent vision loss occurs. During the examination, your vision will be tested, and your eyes may be examined using specialized equipment to check the retina, optic nerve, and other important structures. Your eye pressure may also be measured because increased pressure can be an early sign of glaucoma. One of the biggest dangers of glaucoma is that it often causes no symptoms until vision loss has already begun. Since vision that is lost from glaucoma usually cannot be restored, early detection is extremely important. Cataracts are another common condition after age 50. They develop when the natural lens of the eye becomes cloudy, making it difficult to see clearly. People with cataracts may notice blurry vision, increased sensitivity to light, difficulty driving at night, or colors appearing less bright than before. In many cases, cataracts can be successfully treated with modern surgery that restores clear vision. Regular eye examinations are especially important for people with diabetes, high blood pressure, a family history of eye disease, or those who smoke. Protecting your eyes also means protecting your independence. Good vision helps reduce the risk of falls, improves daily activities, and supports a better quality of life. Even if your eyesight seems normal, regular eye examinations remain one of the smartest health decisions you can make after turning 50. Now let's continue with another essential screening that can detect some of the most serious diseases before symptoms ever appear. The 9th essential medical test is recommended cancer screenings. Cancer becomes more common as we grow older, which is why regular screening is one of the most powerful tools for protecting your health after the age of 50. The goal of cancer screening is not to diagnose cancer after symptoms appear. Instead, it aims to detect cancer early, or even identify changes that could become cancer in the future when treatment is often most successful. The exact screening tests you need depend on your age, biological sex, family history, personal medical history, and other risk factors. This is why it's important to discuss screening recommendations with your healthcare provider. Let's begin with colorectal cancer screening. Colorectal cancer is one of the most common cancers in adults over 50. In its early stages, it may cause no symptoms at all. Screening methods such as stool-based tests or a colonoscopy can detect abnormal growths called polyps before they become cancerous. Finding and removing these polyps early can significantly reduce the risk of developing colorectal cancer. For women, breast cancer screening is another essential part of preventive healthcare. A mammogram is a specialized X-ray that can detect breast cancer at an early stage, often before a lump can be felt. Regular mammograms, based on your healthcare provider's recommendations, can greatly improve the chances of successful treatment if cancer is found. Women should also stay informed about cervical cancer screening, which may include a Pap test, an HPV test, or both, depending on age and current medical guidelines. These tests help detect abnormal cervical cells early, often before cancer develops. For men, prostate cancer screening may be recommended depending on age, family history, and overall health. This may include a PSA blood test and, in some cases, a physical examination. Not every man needs the same screening schedule, so personalized medical advice is important. Some people may also require additional screenings, such as lung cancer screening, with a low-dose CT scan if they have a significant history of smoking. Remember, screening does not mean you have cancer. It simply helps identify potential problems earlier, when treatment options are usually more effective and outcomes are often much better. Do not wait for symptoms to appear before thinking about cancer screening. Preventive care is one of the most effective ways to protect your future health. Now let's look at the final essential medical test that many adults overlook, even though it can affect almost every system in the body. The 10th essential medical test is a thyroid function test. The thyroid is a small butterfly-shaped gland located at the front of your neck, but it has a big impact on your overall health. It produces hormones that regulate metabolism, heart rate, body temperature, digestion, energy production, and many other important body functions. Thyroid disorders become more common after the age of 50, especially in women. The challenge is that thyroid problems often develop gradually, and their symptoms may be mistaken for normal aging. An underactive thyroid, known as hypothyroidism, may cause persistent fatigue, weight gain, dry skin, constipation, feeling unusually cold, depression, thinning hair, or difficulty concentrating. An overactive thyroid, called hyperthyroidism, may cause unexplained weight loss, rapid heartbeat, anxiety, excessive sweating, shaking, and difficulty sleeping. A simple blood test can measure thyroid hormone levels and help determine whether your thyroid is functioning properly. If a thyroid disorder is detected, treatment is often straightforward and can significantly improve quality of life. Ignoring thyroid problems, however, may increase the risk of heart disease, high cholesterol, osteoporosis, and other long-term complications. If you experience ongoing tiredness, unexplained weight changes, mood changes, or other persistent symptoms, discussing thyroid testing with your healthcare provider may be worthwhile. Now that we've covered the 10 essential medical tests everyone over 50 should never skip, let's bring everything together with the most important takeaway from today's video. Getting older does not mean you should expect poor health. In fact, many of the most serious diseases that affect adults over the age of 50 can be detected early, or even prevented, through regular medical checkups and routine health screenings. The 10 essential medical tests we discussed today are not just numbers on a medical report. They are valuable tools that provide important information about how your body is functioning, often before any symptoms appear. A simple blood pressure check can help prevent a stroke. A blood sugar test can identify diabetes before it causes damage to your eyes, kidneys, or nerves. A cholesterol test can reduce your risk of heart disease. A complete blood count can detect problems such as anemia or infection. Kidney and liver function tests can reveal silent conditions before they become serious. A bone density scan can help prevent fractures and protect your independence. A comprehensive eye examination can preserve your vision by detecting diseases early. Cancer screenings can identify problems at a stage when treatment is often most successful. And a thyroid function test can explain symptoms that many people mistakenly blame on aging. The most important message is this: don't wait until you feel sick to take care of your health. Prevention is always more effective than treatment. Scheduling regular medical checkups, following your healthcare provider's recommendations, staying physically active, eating a balanced diet, getting enough sleep, managing stress, and avoiding tobacco are some of the best investments you can make in your future. Remember, healthy aging is not about avoiding every illness. It is about recognizing problems early, making informed decisions, and giving yourself the best opportunity to enjoy an active, independent, and fulfilling life. If today's video helped you understand the importance of preventive healthcare, consider sharing it with your family and friends, especially those over the age of 50. A single health screening at the right time could make a life-changing difference. If you enjoyed this video and want more evidence-based health education, don't forget to subscribe and turn on notifications so you never miss our future videos. Thank you for watching. Stay informed, stay proactive, and most importantly, stay healthy.